This morning, I am honored to introduce Micaela Berry Smith. She is a seasoned leader with more than 15 years of expertise in birth equity, early childhood education, and social entrepreneurship. She is a senior program manager for community, maternal, and child health initiatives at the Foundation for Black Women's Wellness, where she leads transformative efforts to improve health outcomes for Black mothers, birthing people, and families across Dane County and Wisconsin. Her professional journey includes serving as the co-executive director of the Harambe Village Doulas, as well as owning a successful nanny service in the greater Madison area, where she connects in-home childcare providers with professional families. Micaela holds a double major in early childhood development and art therapy from Metro State University in St. Paul, Minnesota, as well as multiple professional credentials, including being DANA certified as a doula, as well as certified infant specialist and a certified lactation consultant. Her work is grounded in both professional expertise as well as lived experience as a Black mother, navigating preeclampsia and systemic barriers to care herself, as well as being the descendant of her great grandmother, who served as a midwife and enslaved women in Kentucky. This intergenerational legacy fuels her unwavering commitment to reproductive justice, community healing, and systems transformation. In addition to her leadership at the Foundation for Black Women's Wellness, Micaela serves as president-elect of the Wisconsin Association for Perinatal Care Board of Directors and associate director of engagement for UW-Madison Prevention Research Center. She has been recognized as one of In Business Madison's 2025 40 Under 40 honorees and named to Madison Magazine's End List Outstanding Social Innovation. Um, the DEI committee is so grateful to have her here today, and I'm excited to hear her talk. So I will hand it over to Ms. Barry Smith.
Good morning, everyone. I'm honored to be here with you on Thursday before a Labor Day weekend, and so early. So thank you so much for giving me your time. Today, I'm going to talk about doulas. I'm sure you probably have heard a lot about them and what they're doing in their work and why they should be included in yours. And I just really want to highlight that we're going to have fun this morning. I'm almost to my birthday, so I'm like having that birthday spirit. So we're not going to keep it, pretty level. We're going to have a lot of fun. And my rookie mistake this morning was forgetting to put my name on the first slide. So that's me. I have multiple hats. I am the Senior Programs Manager for Community and Maternal and Child Health Initiatives. I'll go a little bit more into what that means and how it relates to you and how it relates to OBGYN and Meritor and all of those things. Before I get started, you heard about my bio, but I want you to hear it from me. You're going to read a whole bunch of words, so I decided to put pictures up. This is just kind of a little bit of a snapshot of my life. So I started as a doula. Over here is some of my favorite births. I've birthed over 128 births, predominantly at Meritor as a doula. I started in 2013. I am not from Madison, but in 2013, the Race to Equity report came out, and I was really taken aback by the racial disparities here in Dane County, and particularly in Wisconsin, knowing that it is such a wonderful place for healthcare. And so I thought, as someone who was at the time a kindergarten teacher, what can I do to do some work that related to what I did and could get into the work quickly? And so I became a doula and I became a lactation consultant. And through both my education experience and wanting to change the community, I was able to meet a lot of your fellow colleagues. So in 2018, I did my very first research study with Dr. Ryan McAdams, and you see Dr. Luther Gaston and Dr. Jacqueline Peebles and Dr. Jasmine Zapata, and we did a study for NICU babies. And that ran from 2018 to 2021. Up here, you'll see that I'm at the Capitol, and I'm advocating for policy change for doulas to be reimbursed through Medicaid. That has been a fight that's been going on. We continue to fight it. But I just kind of wanted to give you a diversity of what my background is. Here, I'm with Miss Loretta Ross, who is one of the co-founders of Reproductive Justice Movement. I love this picture. I adore her as a mentor because she too does not take herself seriously, and I always enjoy when she speaks. And currently, I am in UWPRC leadership. I am the Associate Director of Community Engagement. And why I highlight all of these things is I was just a kindergarten teacher and never thought that my career could move in the way that it has. I never thought I would be standing in front of you today. But I wanted to just highlight how each step is not just about me, but it's about the community, and it's about you, and it's about ensuring that we make healthcare better for the future than it is right now. And the biggest impetus of all of that are my babies. I have 2 toddlers, and they definitely keep me humble. They don't care about any of this. So we know the crisis, right? We know what's going on. We know structural racism happens. We know discrimination happens. Chronic stress, social risk factors, social economic factors, environmental factors. We know all of this. We know what's going on in Wisconsin. But what can we do to change it? Why do these things keep happening? And why are we only moving the needle a little bit? Again, the urgency. 9 of every 1,000 babies born to Black mothers in Dane County don't live to see their first birthday. When I was able to celebrate both my kids' birthdays, I did not take it slightly, because I know that their ability to see their first birthday was not the greatest. Even though we are upper middle class, both of my husband are highly educated, we have a great life, that doesn't mean anything because we're Black. We live in America. So what can we do to ensure that our grandkids get to live to see their first birthday? So I kind of wanted to give you a little bit about the Foundation's approach to maternal health. And of course, we are Black women centering Black women, and you already know the reason. So we are ensuring that hospital policy changes support a no wrong way to birth. We know most births in Dane County happen in the hospitals. We are not here to advocate that, okay, just go back into your home and birth yourself, right? We believe in safety, we believe in education, we believe in empowerment. So how can we do that to work together and ensure that these families have optimal results? So a little bit about the Foundation. We have multiple ways to support families with maternal and child health initiatives. And so as you see, we have Umama, which just was launched this year with our partnership ports. It is our doula reimbursement program, or also called the Healthy Baby program through Ports HMO. And with Umama, we're able to support not just Dane County, but all of Wisconsin. And although we center Black women by centering the Black doula, we serve all women. And we really are thinking about those rural areas, right? We know that a lot of the rural areas are having some of the same disparities as urban areas. And so that was a highlight that I wanted to share with you this morning, because that's been an amazing journey. And we know that 75% of births that happen through ports happen here in Meriter. And then we have ConnectRx. I'm sure many of you are familiar with ConnectRx. It is our program under our Saving Our Babies initiative. And what ConnectRx does is it does a social determinants of health screener for any woman who is pregnant. And then for a woman who identifies as African American or Black, it gives them an opportunity to have a doula through the Foundation. They also have a clinical CHW and a community-based CHW to support any social determinants of health. So for ConnectRx, you have to have one ding of a social determinant of health need, typically transportation or food insecurity. And we try our best to ensure that we get those secured before baby comes, but we definitely are able to get those secured by postpartum, and we'll get more into that data as well. And then finally, our last maternal and child health initiative is Reach for Wellness. This initially started as a partnership with Reach Dane to support Head Start young infants and families, whether they were thinking about having more children, were in the midst of postpartum, or were pregnant. We were able to support them with a doula, community health worker, as well as mental health support with Anissa therapy and wellness programming that we offer at the foundation. Currently, we still have Reach for Wellness, and we utilize it for anyone who does not qualify with the social determinants of health. They're able to utilize our Reach for Wellness. So our multi-sector approach with Saving Our Babies, if you have read about the Saving Our Babies report, you have probably already read this. So we really think about internal health system actions, community investments, and system and policy actions. So ConnectRx is under community investments, which was something that we took about 5 to 6 years to really develop. We started this kind of the infrastructure of ConnectRx in 2018 and really wasn't expecting to launch in 2022, but we did. The biggest issue was ensuring that we could get into Epic so that we could communicate back into providers what we from the community are learning with our clients to ensure there's the continuity of care. So as I was saying earlier, we know that 75% of births happen in the hospitals. And that's why it's the importance of doulas in the hospitals, right? And how we can navigate and feel that we're part of the team. And then you guys don't feel like we're just in the room. So a lot of times people think that doulas just offer only emotional, physical, and informational support, and they do. But we also have to think about the education that a lot of doulas, specifically doulas at the foundation, have. Most of our doulas have medical backgrounds, and most of them have continuing education degrees. I would say about 75% of them are either nurses or midwives, and 25% of them are either in the hospital as staff in some other capacity, whether that be a CNA or other roles. Studies show doula support improves outcomes, reducing rates of preterm birth, low birth weight, and unnecessary interventions. At the foundation, all of our doulas are full spectrum doulas. So that means that they're able to support from fertility treatments into bereavement. And with having this work and knowing the disparities, having bereavement treatment is still part of the job. So this just gives you a shot of what a full spectrum doula care can look like, right? So we know conception through end of pregnancy. Now, a lot of times, specifically in our Reach for Wellness program, we go into 2 years of age to support the family. And that doesn't always necessarily mean that the doula is meeting with them consistently, but we do have check-ins, and then they also have support with our community health workers, as well as our emotional and wellness programming that we offer. Community-based doula benefits to pregnant mothers and birthing people. So, we definitely want to think about quality of life, right? And so our doula partners ensure better and maternal health outcomes. One of the highlights I want to ensure is, we think about preparing for their baby, but we also have to prepare the parents or prepare the family for this new person that's coming into their lives. And that's one of the things that our doulas and our community health workers do, is really ensure that these families are thinking beyond the birth room and preparing their lives for what will happen for the next 18 years. And I think that that's one of our greatest features of our doula programming, is being able to walk people and give them a snapshot of reality, right? And let them know that there is life beyond those early mornings and those tireless nights. And I'm really proud of that fact that all of our doulas do a great job of doing that. So one of the things I wanted to do is correcting a myth or correcting misconception that doulas are only for home births or natural births, or that we only advocate for natural births, that we're not aware of the needs for medicated births or cesareans. That was one thing that I advocated for a long time about, was ensuring that doulas could be in the OR, because we know that cesareans do happen, and they definitely happen in the Black community due to high risk. And so what can we do to ensure that there isn't this barrier between professionalism and a myth, and ensuring that doulas are still seen as part of the care team, even beyond the labor and delivery room, or even beforehand. And so one of the things that we navigated was complex medical environments, ensuring that doulas were heard, ensuring that they were allowed to educate and empower their patients as they go into the OR beforehand. And now Meritor has a policy that we are able to be in the OR. The need for doulas in hospitals, the stereotype that doulas are only for home births, undermines their critical role in hospital settings where most births take place. Hospitals often have a higher incidence of interventions, and the support of the doula can be crucial in navigating medical systems. I will actually talk about a success story a little bit later on in my presentation. But the other thing that I want to think about is just cultural competence and empowerment. A lot of times, especially with our ConnectRx patients, they don't always have a support person with them. They don't have a family member or friend. And most often with our ConnectRx clients, we will get a call from the hospitals at that 7th hour and say, hey, do you guys have a doula that can come down? And a lot of times those are cesarean births. And so just ensuring that there's someone there that looks like them does make for a better experience. The outcome may not be what we want it to be, but at least the experience is what matters. And we know that bonding is positive when a mom or a birthing person can remember a positive experience from their birth, whether they had the birth that they planned or they didn't have the birth that they planned. If they can have one positive memory, we know that bonding will be optimal. And thinking about the reduction of health disparity is one of the other things that our doulas do a really great job of, is ensuring that our clients go to all of their doctor's appointments. We've had many clients say that we've had many providers share with us that they hadn't seen their patient until they were pregnant, and that it really was due to the doula's encouragement. And then just ensuring that, doulas are not here to rebel or to make an uprising. We are here to comply with legal and ethical standards. We understand healthcare system and we respect it, which is why we are in the role that we are. And so we also want to uphold ethical principles of respect, dignity, and non-discrimination in healthcare delivery. So as doulas, our responsibility is to respond. So you see that we have the whole journey of parenting from pre-pregnancy, pregnancy, postnatal, childhood, and then ensuring that we are in health facilities, that we're in community, and we're in household. One of our biggest things that we say to our patients is there's no wrong way to birth. And what that means is that we don't, again, say, well, you can only have a vaginal birth and you have to do it with a midwife in your home. That as long as you feel empowered and you feel that you have all of the necessary, as much as you're going to remember, education to move into your labor and delivery, move into early parenting, that the only thing we want is that you and baby come out healthy and whole. And then we get to that first birthday, and get to that second birthday, get to that third birthday, and so on and so forth. So some innovative hospital policy changes. Like I said, we have doula access in the OR. That first was really dependent upon the relationship of the doula with providers and anesthesiologists. And so I'll be honest and say I had the privilege of supporting clients in the OR before this was a policy change. I come from providers, I come from doctors. So I kind of was given the privilege of the lingo and how to kind of move my way into the OR before it was a policy change. But that was something I wanted for all doulas. Not just doulas that looked like me, not just doulas for the foundation, but for any doula and for any family here in Dane County. And Meriter Hospital, Unity Point Meriter, was the first to change the policy, and St. Mary's then followed. And that was innovative because doulas were looked upon as a visitor for a long time or as a support person and was not viewed as part of the care team. And so being in the OR for the last 2.5 years as a policy change was a great win. Another policy change that we had was expanding access, so giving doulas badges. I remember when we first had this conversation with Executive Director Carla Griffin, it was like, wait, what's that gonna mean? Are we doulas just gonna, roam around the hospital? But really, we just wanted to be sure that no one was stopped at security. Like I said before, a lot of times we get referrals at the 7th hour. And so clients are already in active labor and we want to be able to get upstairs to them right away. And so what the badge is able to do is we're able to share from the foundation. There are 2 other doula organizations here in Dane County that are also part of this policy change. And we're able to communicate with security and leadership on who was part of our doula team and who should have a badge. And then they come and do the whole background, thumbprint, ID and all of that. And so that has been a game changer for getting in and out of the building, parking. Even though those are very small, they're actually quite significant. And so quality of life measures. Earlier I talked about our ConnectRx and how we think about social determinants of health and really thinking about the quality of life for all of our clients. We don't just take into account, again, just pregnancy and the short time of postpartum. We look at the person as a whole. We look at family history, such as health or even their socioeconomic status. And we think about ways that we can support them and move them up and improve their life outcome. Currently, we have had 900 touch points. So we launched our community health initiatives in 2022, and we launched in April of 2022. And we have had over 900 touch points from community health workers to our doulas through all of our support. And like I said, doulas improve birth outcomes no matter the setting. All 3 of these are hospital births. We've had a cesarean, an induction, and a natural birth. And you won't know because all you see is happy smiles. All you see is a mommies bonding with their babies and doulas being proud of the fact that they were honored to be part of this experience. And this is what matters. This is what matters at the end of the day. So we talked a little bit about cultural competence and empowerment. That's probably one of our biggest strengths, is ensuring that our clients feel comfortable and safe in their hospital environment and their birthing environment. And in clinics, because we know that that improves health outcomes, not just for pregnancy or postpartum, but also for the rest of the birthing person's life. When they have that positive impact then, and they know that they have to take this child to doctor's appointments, it just creates a better wellness for the whole family and then creates wellness for the community. One of the ways that we make community impact and collaboration is reaching out with other community-based organizations such as Anesthesia Therapy and encouraging inclusive care. The broader impact of hospital policy changes partnerships and setting a new standard for inclusive care and equitable birth experiences. These policy changes improve maternal outcomes and create a model that other hospitals and health systems can adopt. One of the big things, as I pointed out earlier, is ensuring that Medicaid reimbursement happens for doulas here in Wisconsin. we're almost there, but we're not quite there yet. And I know that in 2019, the state was saying and policy was saying, well, we're waiting on insurance. Will insurance reimbursement happen this year? So we're hoping that Medicaid reimbursement will happen as well. One of our physician testimonies, or one of our champions that I call him, Dr. Even Nolander, he has worked with all of our doulas and has always stated his joy of working with our doulas, and was one of our supports in changing the doulas in the OR policy change at Unity Point Meritor. And he just recently spoke at our press conference in May of 2025 about his experiences with our doulas and the professionalism and the support that his patients get from our care. So I was going to share with you a success story. This happened this year, and we had a client with a history of hypertension and diabetes. And one thing that I have the joy of being a part of is Dr. Hoppy's study team. And I've had the joy of having a relationship with Dr. Hoppy since 2018, and really ensuring that all of our ConnectRx clients who do have hypertension, preeclampsia, get into the STAC clinic. And so this client is one of those, and was really having some issues with anesthesiology for her C-section. And Dr. Norset said that he was really grateful for Kay, one of our doulas, who was actually my doula when I had my babies, and helping him with assisting a patient with a challenging anatomy through difficult epidural placement. And so, you know, I know there's a lot of times where it feels like from other doctors, nobody in this room, so don't worry about you, that doulas get in the way when there is a epidural. And so I really wanted to highlight this because all of our doulas get continuing education. It is not necessarily a need for DONA or any other doula certification, but it is a qualification and a expectation at the foundation. So all of this is to say, together, we can achieve better birth outcomes. We can ensure that our patients or our clients feel like they are part of the clinic, that they aren't just a number or another face. We're able to see that doulas are a vital part of the movement, advocating for all birthing individuals in all settings, from home to hospital to the OR. Systems, support system change, hospital policy changes, medical reimbursement for doula services, and remembering there's no wrong way to birth mindset will create lasting impact. And just building a more just future, working together to break down barriers, eliminate disparities, ensure that all mothers and birthing people, especially marginalized women and Black women, have access to the care that they deserve. I want to brag a little bit about what we've done in the last 3 years. As you can see, the clients that we've had, and then our doula births, and then the healthy birth weights that we had in conjunction to our clients and births. So that is amazing, because that was one of the points that we were very focused on for saving our babies, and upping those healthy birth weights. So again, I'll remind you, our clients. And then thinking about optimal gestational age, we've been able to keep the babies in there a little bit longer. Medical intervention avoidance. You see a decline in 2024, and I really think that's a lot to do with 2024. We saw a lot of transits from other cities, other states come to Madison looking for a better life. And they typically would come in their second trimester. And so there's not as much that we can do intervention wise to get them to a better and healthy outcome, but we do all of our best. So that's really what you see there in 2024. And our lactation rates are amazing, which I want to highlight. So what can we do together, right, to change the narrative? We can improve birthing outcomes, and it requires a team approach. Doulas are vital members of the team. As OBGYNs, you play a central role in medical care, but when you collaborate with doulas, you help create a circle of care that addresses the full spectrum of patient needs: clinical, emotional, cultural, and social. Doulas are competent rather than replace your expertise. They provide continuous support, amplify patient voices, and help reduce stress and intervention rates, ultimately leading to safer births and better outcomes. When doulas and clinicians work in partnership, families feel more supported, communication improves, and trust in the healthcare system grows. Together, we have an opportunity to model true collaborative care by building strong relationships with doulas, inviting them into care teams, and aligning around shared goals for healthier mothers and babies. We move closer to a future where every birth is safer, more supported, and more successful. Thank you all for the work that you do and for being open for strengthening these essential partnerships. Just a little snapshot of our Dane County health outcomes with saving our babies from 2018 to 2025. 93% of babies born at optimal gestational age, 93% at healthy birth weights, and that's with 293 births supported by doulas from the foundation. So I welcome any questions, and I appreciate your time today. I want to thank all of you who have been part of my journey. I want to thank Dr. India Carter-Anderson for inviting me this morning. And I just shout out all of my UWPRC and Dr. Hoppy team. Thank you for supporting me this morning. Thank you so much.
Wonderful. Thank you so much. I'm gonna give you a hug. Any questions? We're just gonna get right into it. I've got two, but I'll save mine.
Yeah, I don't have as much a question as a comment, and, you know, I've just borne witness to the work of the foundation, and it's just impressive, and really it's all of the folks in Dane County working together to try and improve these birth outcomes. And so I just want to congratulate you and say that we really appreciate all your work with the department. And I think now's a moment, anything you ever wanted to say to any OBGYNs, I mean, I think you said it, so some of it very politely, but, you know, you've got our attention. And
Yeah.
so, you know, how can we do a better job of getting people involved with ConnectRx? How can we work with you to make sure that we see, or we're seeing your notes in the medical record? You know, that comes up. There's so much in the medical record.
There are so
You know,
much.
just, you know,
Yes.
I just think, you know, we've got a few minutes here. We really ought to take this opportunity to have some conversation.
Well, whenever you talk to Epic, you know, complain about the
Yes.
because I have suggested many times of like a drop down just for community-based healthcare workers or doulas to be able to put in notes so that you don't have to do all that scrolling. That there could be an actual spot where it's like doula notes or community health worker notes that are complementary to what we're seeing in the My Chart as well.
Yes.
So just keep complaining to them, and they complain, and then maybe they'll listen. That's how we got here with ConnectRx.
Yeah, it's really tricky because on the side of the provider and the medical record, there are so many services, and there's just a finite amount of time to be able to jump in and grab information. So figuring out, you know, where it is and how people can get to it very quickly when they need it is key.
Yes.
Thank you so much for anyone who knows theology is just like a light in the room, but you know, thank you for commitment to what you do. Two things. One, can you talk about the dad doula a little bit? Because I'm not sure how many people are aware of that. And then the second is how to find support that you talk about. You know, I don't know how ingrained it is in certain clinics. In our creating those clinics, we do the SUA screening and our social workers refer to ConnectRx, but I don't know how integrated that is within other clinics across the department. So just raising awareness of that outside ConnectRx, how to get connected.
Absolutely. Thank you for both of those questions. I would say that to refer any client if they are not connected to a social worker, to ensure that their social determinant screener is in their MyChart, and then that should get to the clinical host site, which is UW. If that doesn't happen, you are always welcome. My email is right there. Email me. I get emails all the time from providers telling me about the patients that they've been trying to get into ConnectRx or maybe don't qualify for ConnectRx, but identifies as a Black woman and can still get support. Or if they're a Quartz HMO, you can get them through our Umama services. So the best bet is to just email me and then I'll get them to the right space. And then also to answer about the dad doula, we have a wonderful dad doula program with one of our co-chairs for our CAB, for the Prevention Research Center, Josh Liston. And what he does is he trains dads or family members of birthing people to be a kind of a co-doula in a sense, alongside or complementing the birth team and giving them education as to what to expect for the pregnancy, labor, delivery journey, and also just ensuring that there are better outcomes and support for that birthing, not only in the birthing room, but also afterwards. Thank you for highlighting that.
My question is also about how to access the care. I have had really good experiences with kind of that like 11th hour calling someone in and just having immediate support for someone. How do we call you? Or like, what's the best way to get in touch with you?
I can probably give that information to you because it's just my email, but I also have a direct line that's specific for doula support.
Cool.
Yes. Thank you for that question.
That's all right. I have a question for you. I feel like when I see OB patients a lot of times in clinic, I encourage all of them, especially at their new OB visit, if they're planning to have a doula, wanting a doula, to bring them to the visit.
Yes.
So that we can start to develop that relationship early, working as a team.
Yeah.
I can say maybe one patient has taken me up on that.
Yes.
Do you have any advice for what we can do as providers or medical healthcare professionals to help further encourage patients to bring us into the routine visits so it doesn't feel like we're meeting them at the last hour on the delivery?
Yes, and I will say we have learned this really amazing opportunity through the Quartz partnership because we are able to see a little bit more for Quartz clients than we are with ConnectRx clients. So with ConnectRx, we have CareLink Epic, which is just a very short snap of Epic or MyChart, right? And so with Quartz, we're able to see all of the appointments that the client has, and we're able to coordinate care a little bit better with the doulas saying, oh, it looks like your client has all of these doctor's appointments. Are there any that you can make? Unfortunately, with our ConnectRx clients, it's communication, right? So sometimes it's communication barrier of needing a new phone or just forgetting to share with doula. And so it's like, how do we take that responsibility off of them, that stress off of them? Again, it's saying, Epic, can we see at least one little step of when their next appointment is so that we don't have to coordinate care with them. If they've already given consent for the doula to be in the appointments with them, or if they reschedule, we're able to see that right away. We don't have to catch up with them all of the time. So I think it's really about communication and easy communication, working smarter, not harder within the MyChart and not always putting the responsibility back on the patient when they have so many other things that they may be thinking about. So.
Any other questions?
Yes.
I'm Santi. I'm one of the new generalists. Nice to meet you. Thank you so much for your talk. The question is, I think you are in a very special position to spend so much time with clients. And my question to you is, what kind of feedback do you get about how we can do a better job in the limited time that we often have with people we take care of? Things like common themes or common things that folks say.
I think it's the biggest feedback that we get is patients wanting to feel like a person, right? So, and this is typically with from patients that typically have a couple of health concerns or health journeys that they're going through as well as pregnancy. And so not being looked at as their health issue, but being looked upon as a person, and then taking into account what their life looks like and how they can better improve their life with the resources that they have.
Mm.
That's a great question.
Question I have for you. You mentioned this a little in your talk, and I just wanted to touch on it briefly. This kind of bias or notion that has kind of been out there that when patients have a doula, the immediate thought is they're going to want to be non-medicated. They're not going to let us do anything. They're going to give us a hard time during the entire labor. So my question for you is, what do you think we can do differently or better as physicians, especially if we just happen to be the person on call, meeting the patient and or doula for the first time on labor and delivery to help better curate a positive working relationship to continue to break down some of those preconceived notions?
Yeah. I would say, again, communication relationship, right? You are able to make your doula your best friend in that short amount of time. One of the greatest outcomes I have, I've birthed a lot with Dr. Luther Gaston, and he always has a little side hustle with me and lets me know what's gonna, what he's thinking. He even asked my opinion. And that really helps the doula feel like, okay, you are here with me, so I can give that ease to my patient. And I know that we're in this as a team, and it's not just let's get this baby out so I can move on to the next. And it's ensuring that all systems are a go, and whatever system that is, right? And so just ensuring that there is communication between doula and provider, as well as empowering the doula to empower the patient. So then you have a little bit of an ease when things that no one can control arises. I will say back to your question, working together with anesthesiologists, as I shared with that success story, that's not always the theme. And so ensuring that, I feel like we have had a positive relationship with OBGYNs. And so the next step is anesthesiologists and ensuring that they also see doulas as part of the healthcare team and not a burden as well. And that's all I have.
Yeah.